Well, welcome everyone. Welcome to our Focus Forum. I'm Rita Riker, President of the Board of Focus Greater Syracuse, and very happy to welcome you here. Today's forum focuses on how the City School District, together with government and community partners, is supporting students and their families in accessing needed services ranging from temporary housing, food insecurity, joblessness, and poverty to mental health support, crisis management, and more. We have a distinguished panel to walk us through this today. First up will be Janelle Milana, Director of Student Support and Interventions at the Syracuse City School District. With 18 years of experience in education, Janelle leads district-wide student support services. She oversees pre-K to 12 social workers, district crisis response teams, and initiatives supporting child welfare and students experiencing temporary housing. Janelle collaborates closely with county agencies to ensure comprehensive care for students and families. She is committed to equity, crisis response, and creating inclusive environments that foster student success. Next will be Corey Williams, Coordinator for the Office of Student Support Services at the Syracuse City School District. Corey has worked for the school district since 2015 when he was hired to assist the district in monitoring the implementation of required changes outlined by the New York State Attorney General. Much of Corey's work for the past 10 years has focused on addressing inequitable outcomes for students in traditionally marginalized groups by examining the district's procedures and by advocating for the use of widespread restorative practices. When not working for the school district, he has a small job of serving as the 3rd District Common Counselor in the city of Syracuse. Last but certainly not least is Jessica Hobbs, Senior Director of Program Management at Coordinated Care Services, Inc. Jessica is a seasoned and innovative human services leader with over 20 years of experience spanning child welfare, case management, family engagement, and staff development. In her role at Coordinated Care Services, Inc., she leads program operations and drives business development for multiple community-serving programs across Onondaga County. Jessica is recognized for her strategic oversight, collaborative leadership, and commitment to improving outcomes for individuals and families through evidence-based, person-centered approaches. Let's begin with Janelle. Janelle, it's all yours.
Thanks, Rita. Thank you, everyone, for having us here today. We're excited to share with you on how we support our families in our community and schools. I'd like to begin by just sharing an overview of what it looks like in Syracuse City when we are determining how to best support our students and our families. So for those of you that aren't familiar with some key important details is that our total enrollment for the district, we serve over 20,000 students. We have 31 buildings in our school district and 4 alternative programs. One of the key data points that we look at on a regular basis really centers around what we call McKinney-Vento. And those are students that are experiencing temporary housing and loss of housing. And as a district, we determine how to best support that. So when we look at this more in a lens through a classroom, what our children that enter our classrooms, we look at it as if you took a classroom of 25 students. We know that 18 out of 25 students in a classroom are labeled economically disadvantaged. Out of those 25, 3 are often experiencing housing insecurity. 5 receive special education services. And 4 out of the 25 receive E&L services. When I look at a broader lens on McKinney-Vento and loss of housing, we served 2,400 students last year, which makes us the highest school district in our region. We also are monitoring what we call unaccompanied youth. Those are individuals that do not have housing nor guardianship, are in care of a guardian. And we've seen an increase in those numbers over the past 2 years by 50%. So when we dive deeper into those data points and those trends, we kind of want to look at what are their experiences, what's happening, what are their needs. And so the patterns that we see across all the data points really hone into the need for support through mental health services and crisis support, social emotional support in the classroom and throughout the school day, using restorative practices and what we call targeted intervention groups. And then we also are addressing the basic needs and stability of students and families. And we do this through our community partnerships. And that's where Jessica and I start working together, and Corey starts helping us really look more closely at the situation at hand. So as we dive into those needs of our families, we know as a district, we have to determine the best support based on what the students' needs are. And that immediate entry point is usually with their basic needs: housing, food, clothing, sometimes medical and care, mental health care, and acute crisis. So that's a lot of times where we enter the situation. From there, we determine what are the best supports a child needs throughout the school day, but also beyond the school day. And that's where all these partnerships come into play, because we know it takes all of us to support a family. It doesn't just happen between the hours of 8 to 3. There's ongoing support that is needed so the child can come to school really feeling secure and happy and having their needs met, so we can get them into the classroom and ready to learn. The only way to do that is really through assessing what these families needs. And we do that through connecting youth and family to community activities, supports and services, mental health services, and also supports that help families who have children with developmental disabilities. In addition, we also work with our county partners through DSS, Catholic Charities, to name a few. So when I look at that for my job, what does that mean? What do we need here in Syracuse City? And one of the things walking into this role about 4 years ago, we knew we had to create a stronger system of support, and really align our systems with other systems in the county, right? It's not just what's in our district, which we had to align that to, but also outside. So I always use the term, we needed to lean in and intervene. And that's where our county partnerships and community agencies come in. So when we start focusing on what we call McKinney-Vento services, I work directly with Access, in which Jess Hobbs will talk about that in a few moments. But we have formed a partnership with them through our referral process. We also work with the Department of Social Services and Catholic Charities. And a lot of the work we do together is identification, outreach, and monitoring of families, and also targeting specific families that might have more emergent needs. We also have another partnership called CCSI, and this is where we have supports within our district in each individual building. So every building has what we call Promise Zone specialists, family support specialists, and our access school liaisons. Combined, all these supports combined help us to really target a lot of the housing needs of families, mental health needs of families, and crisis support. In addition, this year we created a new support system through child welfare. And one of the things we notice is that families in crisis or experiencing housing have a more, there's a tendency that CPS is involved in their situation. For many reasons why. So we created a school-based child welfare teams where the county has aligned 6 workers, 6 key CPS caseworkers and supervisors to support the school district, because the majority of their cases come from Syracuse City, so we can have a faster response time and we work more collaboratively. So we're supporting before we actually report, right? That's the key. We want to support families before they get in such a high state of crisis that child welfare enters the building. So all of us work together to really figure out how to do that well and to get our systems and our procedures and our protocols and even our communication strategies aligned to one another. So Corey, I'm going to pass that over to you.
Yeah. And you know what? I think, Jess, I'm going to jump over to you because I'm going to touch on the mental health, but also kind of dovetail into the SDL. And I feel like Janelle just kind of laid out the partnership between the district and the county. So I'll let you take it from here.
Perfect. Thank you, Corey. Good afternoon, everyone. My name is Jessica Hops. I'm the Senior Director at CCSI, and I'm going to talk a little bit about our partnership with Syracuse City School District through the Access program. So Access has been in Onondaga County for over 15 years. It's the established CSPOA, which is the Children's Single Point of Access for all children's mental health services from ages, we support youth ages 0 to 21. And what I'll talk a little bit about is how in the last 10 years, we've really deepened our relationship with Syracuse City through the school liaisons. So 10 years ago, the school liaison role was developed and it came from the Children's SPOA. And what this is it's school liaisons who are assigned to each school building in Syracuse City School District. These school liaisons meet with the student support team either weekly or bi-weekly. And those teams normally include the school social worker, school psychologist, nurse, building administrators, and other school supports that are supported in that building. So that could include maybe Promisone, FSS, other student support programming. And when they're at these meetings, they're there to really offer support for any youth, whether it be in the tier 1 intervention, so that universal support, to really high level acute needs of a youth through the tier 3. And what we do here is we take referrals directly from the school building and reach out to families and offer support. Some of the supports that Access can offer is connection to children's mental health services. I think one of the very unique things about Access is there's no criteria around insurance. There's no criteria around a certain acuity of need. It's really designed to meet youth and families where they're at and offer support. So I can go over some of the services that we connect to through Access. As I mentioned, we are the Children's SPOA. So with that, we would offer supports anywhere from skill building to in-home therapeutic support, connection to outpatient mental health treatment, and as high up as residential placement for youth. Some of the evolution of Access is that we've really moved not only from focusing on that children's mental health system, but really broadening our scope of support. So that full global support of meeting families, hearing from them what their needs are. What we often know is that in addition to children's mental health services, families are often having other additional struggles that they're looking for support around, such as maybe housing, maybe adult mental health or developmental delays where they need connection to services. Our staff are trained to really focus on the first area is relentless pursuit of engagement, really meeting families where they're at the level of engagement that they're comfortable with, to then moving into more of that full global assessment. Obviously focusing on the services that the family would like to be connected to, but also making sure that our liaisons have the information around other resources that are available in the community. If families require short-term case management where they would like to stay involved with us for a short period of time to kind of navigate some of this, some of their needs, we are available to do that. And another area that we are supportive around is like wraparound meetings. So this would be a time where maybe families are reaching out and they have services involved, and they really want to pull everyone in to ensure that the services and the supports are really meeting their needs. So I have some quick data that I'd like to share. So through the McKinney-Vento process, as Janelle mentioned, anytime a family has the status of McKinney-Vento, it generates a referral where staff from the Access team are immediately reaching out. In 2022, we received 500 McKinney-Vento referrals. Out of those, 476 were accepted, and families were open to engaging with our liaisons. In 2023, we received 683 new referrals, and out of those, 646 were accepted. And in 2024, we received 692 referrals, and out of those, 684 were accepted. In addition, we also, as I mentioned, have that process in place where our liaisons are meeting with the buildings and taking referrals directly from the buildings. And in 2024, we received 1,178 referrals, and 1,019 were closed where the families were either connected to services, wraparound support was offered and successful in addressing any needs, and meetings were facilitated where natural supports were really pulled in to support the families in their goals. I think another important piece of the Access program that I really wanted to highlight is that a majority of our staff are FPA certified, which means they're family peer advocates. So staff themselves have had either children or family members that they have cared for who've been supported through some of these child serving systems. Our staff that are FPA eligible receive training and support through Families Together in Albany. So that's such an important piece of the program, is having staff who have that experience of having their child or someone that they're caring for who's been supported through the systems and understands firsthand the barriers that we sometimes have to work through, and just how challenging things can be. So I think that's an important piece that I always like to highlight when I'm discussing the Access program. So with that, Corey, I will turn it over to you to talk a little bit more about the clinics and other mental health supports.
Sure. So like I said, I'm kind of going to talk about the bridge between two different topics, one of which is mental health, and the other is the term that you heard Janelle mention earlier, which is our social and emotional learning. When we talk about social and emotional learning, we talk about some core concepts such as self-awareness, self-management, social awareness, relationship skills, and decision-making. And while mental health and social emotional learning are different, our experience is that they're highly correlated in our buildings. And so, I'll talk a little bit about what we do for mental health and for SEL. Similar to Jessica and Janelle, I've watched a lot of transition and evolution in our district. And what I can say is that in terms of what we're offering our students in terms of mental health support within our buildings, we're at a point that we've never been at before. We have school-based mental health clinics at all of our buildings with the exception of the brand new Steam High School. Our two main providers are Liberty Resources and Upstate. And Liberty has taken a much increased role over the past couple of years. They offer fairly traditional mental health support, and they have a caseload of students that kind of can be in flux, be in evolution throughout the year. And they're at all of our buildings but three. The three buildings where Liberty is not located, we have a brand new and really exciting partnership with Upstate. As I mentioned, we're currently in three buildings, and we're hoping by the end of school year 27, which is next school year, to expand that relationship to 9 different buildings. Every school that has a relationship with Upstate has 2 different practitioners. They provide case consultation and medication management. We have a psychiatrist, an NP, social workers, and one of the real important components of that upstate program is to bring in providers from a diverse background. Our school district is roughly what's about 80% Black and brown. And so in order to have providers that better reflect our community, there's a lot of intentionality in who we have working with our buildings from upstate. So that's really, really exciting. Upstate is hoping to continue the relationship with our district to allow for clinical fellows to have placements within our district and be able to refine their skills while providing a really important service to the community as well. In terms of what we're doing proactively, again, kind of the relationship between SEL and mental health, we've been conducting what we call universal screeners, meaning we give an assessment to all of our students related to SEL since about 2018. And at that point, we were using a screener produced by Panorama Education that looked at a variety of SEL skills, like I mentioned, social awareness, self-management, growth mindset, self-efficacy, and emotion regulation. While we were doing that, we were also running what they call the YRB, the Youth Risk Behavior Survey. And that is a national survey that's put out by the Center for Disease Control. The thing about the YRBS is that it only happens over 2 years. And so we had a little bit of a disjointed SEL screener over here and a behavior and mental health screener over here, and they were happening on a different cadence. So what we've been doing, we have been shifting to a new tool, which is called BIMUS, which was developed by a man named Jim McDougall, who has ties to our district, actually. And what BIMUS does is it kind of brings together the SEL, kind of the learning and skill component, with mental health concerns, and it includes what we call a critical indicator that essentially asks our students if they have been considering self-harm or if they've had suicidal ideation in the past week or the past month. And if students respond affirmatively to those items, we have stationed and in place a mental health response team that can meet the immediate needs of each of those students. And so, as we move forward, we're going to be continuing with the BIMUS and we're not going to entirely phase out the other products. But it's a really big step to proactively be kind of tracking and monitoring student mental health and to be able to provide immediate help for those students that need it. Other things that we're doing related to our social and emotional learning. We take the data that we collect from Panorama, from the YRBS, and from BIMUS, and we identify students that have similar needs in terms of their SEL. And you heard Jessica mention earlier our tier 1, our tier 2, our tier 3. That's some education lingo for basically the level of intervention needed to get students to where we want them to be. Our tier 1 is what we give to every single student in the district. Our tier 2, we think about being a much smaller group, about 15% of our district, and there are students that need a little bit more support. And then we talk about the tier 3, which are those really intense interventions, and often that's about 5% of our student population. So what we do with both the SEL and the mental health data that we collect is we create what we call skills groups. There are groups of 3 to 8 that meet with a teacher, typically once a week, and often we have a period of about 6 weeks at a time in which these small groups get together. They have some component of team building, and then our practitioners very, in a slick and sly manner, bring up some of the skills that we're trying to develop in our youth and wind up having conversations and opportunities to learn and practice related to that. So, a lot of what Jessica and Janelle talked about were, what we were doing in response to needs that occur. And a lot of the work that I do is trying to be proactive, trying to identify, trying to target before both our SDL concerns and our mental health concerns reach the level of that higher intervention. And Janelle or Jessica, you can jump in with anything I may or may not have forgotten.
Yep. So just to add to what Corey's saying, something that we created in the past year, we've been working on for last school year and this school years, we've created a district crisis response team. There's 2 teams to this larger group. One handles more of the acute response for mental health and behavioral dysregulation. So we can be more responsive and create better plans and plans of support for the child, and also enter into a situation where we can look at the child holistically to determine what the best needs are, not just for the child, but for the family. Because when the child's in crisis, so is the family. They're trying to learn how to help their child be successful, not just in school, but in life, right? And for to help with the family dynamics of what maybe some of those behaviors may be displaying at home. In addition, we also have an itinerant social worker team that they're assigned across the district to the different buildings. They are a support in addition to the social workers already in the schools, and they offer more of that tier 2, tier 3 support, more intensive and targeted support for students that may be displaying challenges with mental health and behavioral health regulations. So we created these 2 teams to really become more intentional and dedicated to time for the interventions, in which the building level may not be able to pull off with the resources they have throughout the course of this school day. That is fairly new, and it seems to have been very helpful over the past year. On the district response team that looks at the acute crisis, we have 2 individuals that extend and reach out to the families to involve them in the supports and interventions for the child. And then we also added a student advocate role, in which we have an individual that helps represent the student to help articulate their needs if they're struggling, and also really be a support person for that child in the school building. Jess, is there anything else you want to add?
No, I really think that, thank you for having us. I mean, it was a great overview.
Okay, then it looks like we're into the Q&A portion of this this session. And we had received a number of questions ahead of time. There's also some potential time to address questions if people want to put them in the chat. But our board emeritus member, Brian Hoke, is going to lead us in a Q&A. So thank you so far. Some wonderful information, and let's go with Q&A.
Thanks, Rita. As Rita said, I'm Brian Hoke. I'm happy to be here and delighted you all are here with us. I'm just getting over a cold, so apologies in advance. Sneezing and nose blowing doesn't make for wonderful live streaming, but here we are. So I'll try to keep it to a minimum. We did have a number, as Rita said, of questions submitted in advance. We'll get to those certainly. If you all are guests here watching today, feel free to put things in the chat or the Q&A feature, and we'll try to get to those as possible. I wanted to start just to pick up on something, Janelle, that you had mentioned. Jessica, you shared some statistics over time, and I didn't bump on those as being precipitously rising. But Janelle, there was one statistic you mentioned for kids that are both homeless and without guardians. And I think I was correct in hearing that number went up precipitously in just a few years. Just because I was curious, and I don't doubt that others may be. Wonder if you might expand upon that just a little bit before we get to the other questions, please.
Yeah, I would like to do that very much.
Thank you.
Actually a concern
I can imagine.
Can you?
I can imagine. Sorry, I was just,
Yeah.
yeah, sure.
Yep, no problem. It's a concern, a really growing concern in our community, and every chance I have, I like to point it out, because I don't see it improving until, as a community, we take some action and get some solutions for our youth. So McKinney-Vento, there's a lot of different ways that students are receive that services. They come in for many different reasons. An unaccompanied youth is someone who's lost parenting, like guardianship, or not in care of their guardian, and housing. Over the course of 2 years, and Corey can also chime in, we've seen this number gradually increasing. Where the challenge comes in for the youth, and a lot of times our mindset goes to high school level students. You think of runaways and teens that are having conflict at home, and that is a portion. But also students that are removed from the home through child welfare, CPS. We call that a direct placement. Students that experience that also are considered McKinney-Vento at that time, because they have been removed from their guardian, and also they have lost housing. So as we've seen an increase in maybe child welfare cases, we also see an increase in our unaccompanied youth. Where I start to get concerned is that we have many systems throughout our county in place for families, right? And I think I want to give a shout out to DSS, the county. They have really created a system of support. So when shelters are full, the overflow goes to hotels across the county. And families are able to stay there. However, when a youth is not in care of anyone, the only choices they have are to stay with at a friend's house, a relative, maybe a relative or a friend, family, and they can go to shelters, but sometimes shelters are full, or they won't go to shelters. They don't want to go to shelters. That's the other problem that we have. And so we don't really have a place for kids to go to, which then results that they sit, maybe on the streets,
Sure.
sleeping in abandoned buildings. We have found them outside, found the students outside of our school because they don't know where to go, and really finding safe places for kids to stay. Another area where I see it getting difficult is when a student has a developmental disability and they become unaccompanied. There's not a lot of places that will take them in. We have some wonderful respite centers, and they really do help to support kids, but that's only for a 21-day stay.
Right.
And so it's not for everyone. So we do have some supports available through the county, but we do get stuck for a handful of them, in which they really don't have a lot of places to turn to. And finding them housing really takes a lot of our building leaders and social workers. They're calling friends, families, and really pleading their case and getting secure housing over their heads until we can find a better solution. So that's really unaccompanied youth is a growing concern in our community. I will say that.
Wow.
And Brian, if you don't mind, I was going to say,
Corey, please. Yeah, jump in.
For context, Janelle talked about kind of the last couple of years. If we look at a larger time span, really traditionally, about pre-pandemic, our number of McKinney-Vento students, which is the more generalized students who are dealing with housing instability, we typically thought of that around 1,200, and it would go a little up, little down, little up, little down every year. And
And I'm sorry, out of a total population of ballpark?
19, 20,000. You can
Okay. All right. So
roughly
not
20,000.
insignificant. Yeah. Okay.
Yep.
Got it. Thank you.
And after the pandemic, we've seen that number grow and grow and grow. And
Wow.
last year, we finished the year over 2,400 students. And
Huh.
in my time in this role, we often take our new educators and we do similar to what Janelle did here today and say, here's a snapshot of what our district looks like.
Mhm.
And with that McKinney-Vento number, I can remember providing training to our new educators and talking about 5%, meaning 1 in 20, meaning that there would be one student in every classroom who
Yeah.
has been experiencing homelessness. And then that 1 in 20 turned to 1 in 10, that 1 in 10 turned to 1 in 9, that 1 in 9 turned to 1 in 8. And so we're gradually seeing that
Wow.
number creep up. And part of that, I want to give a compliment to Janelle and her entire team, because we only know if a student loses their housing if they tell us. There
Right.
aren't a lot of ways beyond DSS and CPS
Sure.
to find out about a change in a student's housing. And so Janelle and our team completely revamped how we identify, how we document the communication between organizations and agencies to make that process less cumbersome, less intimidating, and a whole lot easier to be able to directly connect our students and their families with support. And so, I think it's a combination of two. I do think that our community has seen issues related to housing insecurity and the cost of rent
Sure.
and housing shortages, but also a revamp of the system allowing easier entry.
Got it. Which, I mean, even though the numbers are daunting, you want to know, right? It's better if you know with a higher number. And not lost on me, the fact is these kids are coming to school. I mean, goodness, under the most challenging of circumstances. God bless them,
Right. So one of the things too, I want to add to that, I try to make a lot of our systems, especially when it comes to McKinney-Vento, as confidential as we can, because really that's what families want, but more responsive, a quicker response time. And so we use this QR code where all schools have a poster, and kids can really
can raise their hand
scan,
themselves.
well, they can scan the QR code and it goes directly to my central level team, our central office team. And we can then help people more directly if they want more privacy around that. So that was identifying and knowing they're going through this is key. And that's where we were struggling several years back. We couldn't really get a grasp of who really needed support. And we really needed to look at that documentation, identification, and enrollment process. So, and Corey helped me with this. We created pretty much an online web-based enrollment process. So we just work more intentionally and effectively.
Yeah.
Interesting.
And that's where Jess gets an automatic referral from us. So when that happens, when we enroll kids and families into our McKinney-Vento services, it kicks out an email automatically to Jessica's group, alerting them that we have a new enrollment. And so now her access school liaisons get assigned more quickly and can get out to the family more quickly to support them.
Gotcha. Jessica, did you want to come in on this?
Yeah, and I think one of the things
Please.
that I would really love to highlight was that last summer, some of the commitment from the school district and through Access was that last summer, in addition to the support all year, is that there was an additional outreach all summer long. So Janelle would probably know the numbers a lot better, but I'm going to go with around 1,900 youth were identified at the end of last school year as McKinney-Vento, and
2,400.
2,400. See, I knew Janelle would know the exact number. Is this summer, what we did is, with the partnership of the school district, the Access team reached out to every youth and every family on the list to support them during the summer, support the start of the school year, because sometimes there's transitions in housing during the summer, and we didn't want that to impact the first day of school. right? So have everybody ready for that first day of school. So there was a lot of collaboration and outreach to those 2,400 students during the summer months.
Right. And to add to that a little bit more, because I think people don't, I need people to understand the vastness of this, right? So, and the coordination it takes. So we know as a district, one of our initiatives is to improve attendance. And we also know that McKinney-Vento students have more of a pattern of chronic absenteeism, right? And part of that, what plays in a part of that is this transition that Jessica just mentioned. We don't get that information or those updates. Therefore, busing cannot get to the family in enough time, right? Like in a timely way, in a timely manner. And so part of offering these services is not just to identify with the initial, but to constantly update the information. And so that's important because our transportation department also gets an automatic email alerting them. So as Jessica's getting that, so is our transportation department, and we can start working on getting a bus for the family. In addition to that as well, we've worked with the county and we're working really hard. It's a hard thing to do, but they have, when families are at the hotels, they try to organize them by the start times of the schools so we can streamline the busing route, because we had a bus driver shortage. We still do, right? But we're in better shape than we were a few years ago. And that way we can really organize our supports and collectively work together to eliminate kids missing school. And because of that, 52% of our kids last year had improved attendance.
Wow, that's great.
That were labeled McKinney-Vento, right? 52% of the students receiving McKinney-Vento services had improved attendance last year.
That's great. Well, we had a question from Tiffany about logistically, how do you manage all of your community partner relationships, the software platform, spreadsheets? I'm going to call that question answered, right? If not in total, you dug deep into this. Yeah, and that's great. Automated emails and QR codes, and so cool. That's interesting stuff. Creative ways to handle difficult problems. I'd like to, if I may, switch to a topic of questions, not a specific question, but a few came in related to how can, and one of the many reasons I love being involved with this effort, these forums and this focus organization, is people want to know how can they get involved, right? How can not-for-profits help out? How can people make referrals? How can caring, thoughtful, interested citizens in this community get involved and push the ball forward? I wonder if you might say something about, is it awareness? Is it fundraising? Is it come in and volunteer? How can organizations and individuals in this community help with the challenges that you're facing and the solutions you are providing?
Sure. I do think there has to be an awareness of how this really filters. We're talking about homelessness. We're talking about lack of affordable housing. But really getting more into that granular, like how does this filter out in the life of a child, right? And understanding that just because they may have shelter, it's not the only thing they need. The family's going through a lot of crisis at that time. And there are a lot of sad stories out there, and a lot of good ones too, right? When we help each other, but the way they enter it is very stressful. So I think the awareness piece is important. I think really looking at that unaccompanied youth portion, like how can we start building a better support system for youth that are losing housing and guardianship and have no place to turn to? How do we reach out to them and get them safe, especially on the weekends? We have the holiday season coming up, and we're very worried about some kids to make sure they have a roof over their head, that they are getting food to eat, that they have clothing and toiletries and all their basic needs being met, and not to disregard that, even though they may not be the majority of our numbers, they are growing into a larger concern each and every year, right? And so we haven't quite figured that piece out yet. So that would be a great way for community members to get involved on that outreach piece of it. And Corey and Jess jump on in. These are just a few thoughts off the top of my head. One part I do want to point out is we started to use a care portal, which is an online request for help that local churches can sign up to be on. And what we do is we submit a name of a student or a family and what their need is. And then it goes across New York State, and any local business, local church can adopt that person and then help really support what that need is. So for an example, we had a family who lost their housing. Dad was working a couple jobs. They were staying in the hotel, still trying to find a permanent residence. And the tires on his car went. And his car was his means to work, which was trying to get that security deposit to get the permanent housing. And so we put this family into the care portal, and a church adopted them, bought tires for the car, helped them figure out a portion of that security deposit, and was even able to do things like buying them gift certificates to grocery stores, just easing that financial burden off the family so they can get into permanent housing.
Wow, that's great. I mean, that's a heartwarming story. Janelle, that's if there's a URL, a link to that you can share, either in the chat now or later, we can make that available to folks. But that's great. It's interesting.
Brian,
Thank
one
you.
more thing that I'd add is that
Corey,
we have
please.
a fantastic network of community-based organizations and nonprofits to operate within the Greater Syracuse area. And kind of as we're seeing a shift of funding from the government, from federal government to the state to local to organizations, money is going to be really important to a lot of our CBOs. And so if people do have the opportunity to give, I know that there are many nonprofits and many CBOs that are trying to fill gaps in their budget right now.
And would indirectly or perhaps very directly assist in these efforts we're talking about here.
Correct.
Gotcha. Cool. All right. Thank you. Jessica, did you want to come in? Anything on that topic?
No, I think Janelle and Corey did a great job of covering all those pieces.
Okay. Paul from Access CNY, with whom I worked in the past, asked the question, are there any new approaches to connecting students with mental health services? And I think you've talked quite a bit in your prefatory remarks, but I wonder if there's more you might say about the newness of it, and you have a little bit. I wonder if we might expand upon that just a little bit, please.
Yeah, absolutely. So in addition to through the partnership with the school district and referrals, there's always an open access for families themselves to reach out for support through the Access intake line, which is 315-463-1100. And one of the areas that the program has really deepened our support is around supporting youth with mental health and intellectual needs through our partnership with Access CNY. So this is a new way that we're able to, as I mentioned, like really understand youth who need support in both the mental health system and the OPWDD system. As many of us know, those don't always work well together. So we have a new approach where we're able to have staff for youth that need support from both systems to really understand the youth's needs and find a way to bring those systems together with Access CNY to really ensure that this very vulnerable youth, this very vulnerable population receive the support that they need.
That's great.
Yeah.
I think too.
Janelle, Corey, did you please?
Oh, I just wanted to add, I think the school-based part, one of the things we're working on with Upstate is really trying to close that gap of providing comprehensive services to some of our most complex students. And so we're looking at different models that involve like virtual intakes with parents and virtual therapy when appropriate. And so just looking at different ways to provide support instead of just the traditional model of in the building, it's a one-to-one. We might do group therapy. We might do, just anything different to engage students and families that really is customized to how they would like to engage in therapy. And I think that's really important because when we talk about mental health services, we just have this, vision of a counselor and a person. And mental health can be really serviced in many different ways. And so really looking at those different interventions. And in addition, we also are engaging more in what we call complex case reviews, where we get all of the services around the table, because there's some families that have a lot of services. So we're resource rich, but we're coordination poor. So one of the biggest things we've tried to do is coordinate better between all the services and create action steps that align our practices and not duplicate them. And that's really been key over the past year. We've seen a more positive impact with the student and the family.
Gotcha. Cool. Thank you. Corey, did you want to touch on this?
No,
We good?
just kind of to point out that we have in our department allocated more staff and resource to the actual issue of mental health. We now have a director of mental health, and we're trying to hire for an assistant director of mental health. And so we're making a very conscious decision to, fund with intentionality to try to address the mental health concerns of our students.
Gotcha. Well, thank you. Well, thank you all, Corey, Janelle, Jessica. I see we're just about out of time. Rita, I'll turn it back to you.
Thank you. And I'd like to add my thanks to Janelle, Jessica, and especially Corey. We had a very last minute substitution of panelists this morning. So Corey, thank you for being so flexible and joining us.
You're welcome.
And of course, thank you, Brian, for your excellent Q&A moderation. As with all of our forums, this one will be posted on our website probably in the next couple of days. So please feel free to share with others who may be interested in learning more about all the wonderful things you're doing at this school district. We're also very grateful for those who have helped us keep Focus going through their donations and sponsorships. And I failed to mention earlier, but we're very grateful for EDR for their sponsorship of this forum. So if you're so inclined, there's an easy way to donate to Focus on our website, and a donation of any amount is greatly appreciated. Other than that, we got a nice weekend coming up, I hope, and thank you all and have a wonderful day.